Hello everyone, I'm Andy Wozny. I work for the Division of Services for Aging and Adults with Physical Disabilities.
And I'm Eddie Ashby. I'm the project director for Money Follows the Person with Division of Medicaid Medical Assistance.
As you'll see up here, the Care Transition Team, that is, Eddie works for the Division of Medicaid, as you know, and Medical Assistants were with the Division of Aging. So after it leaves with the ADRC options counselor, it either goes, they basically look at the assessment and they say, well, let's send it over to Eddie or let's send it over to the Division of Aging to see what services are appropriate for this client. The care transition process is one that often, Eddie will determine whether or not a person's eligible, and I think the terms are like 90 days in a nursing facility.
It's 90 days in a long-term care facility that can include mental health hospital partial stay. It can include a hospital stay, and they need to be Medicaid eligible at least a day before discharge.
Yeah.
So we look for that.
And this rule, this has changed from when we originally started.
Right.
Where they're softening up the rules as to eligibility. Under the Money Follows the Person program, Eddie's going to talk to you about that.
Okay, under Money Follows the Person program, I went ahead and described to you the eligibility. They get intense transition coordination care for 365 days once they're discharged. But before that discharge happens, there's a whole process. We go out and meet with the family, the referral, the facilities. It's a whole process, and I know one of the things that we're hearing from facilities and referrals, again, like Sharon had said, is feedback. So we're trying to do that. Our transition coordinators will go ahead and contact the facilities after they've initially met with the individual to let you know whether that's a viable discharge and what the next steps are. The whole process is person-centered as far as the discharge, the planning, the whole thing is centered around the individual. We're just players that help that individual go to the least restrictive environment where they want to go in a team effort with everybody involved. I can give you a little information about some of the folks. Let me just tell you a little story. We had an individual who had been in a long-term care facility for about 7 years, and he had an interest to go back home into the community. He didn't have any family. He had very little contacts and friends out in the community. Through the effort of working collaboratively with that facility, we were able to put a plan together. He got housing, which didn't happen overnight. It was applications. He had to qualify, but he finally got an apartment. What stands out in my mind for John was that the facility that he lived with for 7 years became his family. When he was ready to be discharged, they got together and they gave him a going home shower. And they got him little personal things, not expensive, but I think there was an Eagles throw blanket. There were little mementos. They all wrote him cards with their phone numbers or good wishes. When he was discharged, and I happened to go with the transition coordinator to his home, he proudly displayed the blanket and all the cards were on the wall. That was his family. So to me, that was like this real together commitment where everybody worked together, and they were his family. He had lived with them for 7 years. He is still out in the community. He had an amputation, and he was in the hospital for, I think, about 2 months. And after 30 days, they come off of the MFP, and we deduct that 30 days, and then he went back on MFP so he could continue to get the full 365 days of discharge services. He has been off of MFP, and he is in the community with the disabled waiver services, and he's doing wonderful. We continue to get reports and phone calls to the transition coordinator because John's a nice guy, and they still have a bond together. I'll tell you a little bit about the MFP services. First, we've discharged 56 individuals just through the MFP program since the onset of October 2008. Two have returned to long-term care facilities because of increased medical needs. We had 3 who passed away during the process for increased medical needs there wasn't anything, they got the intense services, but one had a tumor, there were some different things going on. 43 have graduated MFP through the 1-year service, and 12 are still in their first year. In the beginning, when a person is discharged, they get the transition coordinator services. They get a transition coordinator through MFP, and that service they come to visit them twice a week the first week, once a week the second month, and twice a week the first month, once a week the second month, twice a month the next month, and then once a month for the next, till they finish out their 12 months in MFP. Some of the services individuals can get with the MFP are, they get application fees, so when they're in a facility, they can go out and apply for apartments. They can have, there's a set of workshops through independent resources that they can qualify for that help them with services to go into the community. Workshops on money management, on transportation, on nutrition, different kinds of classes to help prepare them for when they're out in the community on their own. They can get a security deposit for their apartment. Once they have a secured apartment, MFP will provide the security deposit, setup fees for furniture, household supplies, dishes, shower curtains, all the things that you would think going into an apartment for the first time you would need. They also can get personal attendant services for up to 30 hours a week, depending on their need. That's in addition to their waiver services that they would get. They also qualify for home modifications if they need it. If they want to go home, we've had folks who've gone back to a family, and the family said, I could bring John home, but we don't have any way for his wheelchair to get into our house. So we've been able to provide a ramp, widening of doors, a roll-in shower, grab bars, different things to make the place that the person's going to live accessible. Out of the 56 individuals that were discharged, 20 of them were aging, 30 of them had physical disabilities, 2 had developmental disabilities, and 4 had mental illness. MFP, if someone's going to be discharged through the MFP program, the referral can come through the ADRC. We also receive referrals from individuals and facilities and their families. They heard about MFP or somebody was being discharged through the program. One of the things I wanted to stress is that I heard a quote when someone from CMS came to do a site visit with us, and he went out to a facility, and the facility had said they had a waiting list. And he said, let us help you take the individuals who do not need the intense, great care that you're given in those facilities. He says, let us help discharge those folks that can go in the community so that we can open up spaces for those individuals who need your services. So sometimes we've been asked, are you trying to take the folks out of our facilities? And that's not it. We want to work collaboratively so that individuals can live in the community if we can make a safe discharge, so that the facilities that give the great care can be those who we can get more folks into there who need your services.
Folks, not everyone qualifies for Money Follows the Person. Folks that do not qualify for Money Follows the Person but still want to come out and need help in getting out of facilities can apply through our agency. We have programs under our Medicaid waiver program, such as assisted living, which I'm sure you're all familiar about. Assisted living is for folks that don't need that very detailed work that the nursing home facility gives the folks. A little less need, more independent. They can own their own car, they can come and go as they please, etc. What we tend to find is that folks with assisted living are really folks that really do well in the community. The reason that they're not under Money Follows the Person is because Money Follows the Person. There must be 4 unrelated folks in a home. And so, as you know, in the state of Delaware, our assisted livings are big communities of folks. If we had smaller assisted living groups, they would qualify for Money Follows the Person. So maybe that's something for us to look at in the future. The other thing is, we have an adult foster care program. Our contractor is Generations Home Care. Adult foster care, we transitioned someone recently out of one of the state's facilities into an adult foster care program. The issue that I tend to see is that we can't sell it to individuals because most folks want their own place. But we do have an adult foster care pilot, an adult foster care 2 pilot program about to happen. We're getting that started through Generations Home Care, and basically what we plan to do, we're going to start with 4 individuals. So if you know anyone, we're looking for folks that need the Medicaid waiver program, but we can provide that in an adult foster care home in a level 2, which is something we do not provide in our adult foster care program at this time. The folks that are in the adult foster care program at this time are folks that have SSI and can get services that way if they need them, but basically they're more independent. So we're looking for 4 folks for our pilot program within our division. The other thing to remember is we have the Harrington House down in Harrington. We have a family living, a husband, a wife, and their child living in there. It's through United Cerebral Palsy. Really a great thing about independent living. We also have the Dartmouth Woods House. United Cerebral Palsy is getting the mortgage on that home, and we're looking for individuals to live in that home. We're looking for 4 folks, some MFP and some non-MFP. And then there's always those folks within our division or that don't want MFP but want to come out, and we can do that because we have the community service program that we have folks, our staff, our case managers, our nurses, who are very capable and willing to do that without the intense scrutiny of MFP. The other thing that I did want to talk to you about, I know we have lots on the screen, and I know that's all been discussed as to how this all works. The ADRC, you make your phone call, and then it's routed to Eddie and I, and then from there it goes right on through the process of being assigned either from Eddie's staff or our staff, and then as you know we have meetings with the nursing home staff. But what I really wanted to touch base with you today too is about this. I recently went to a self-determination conference, and Liz Weintraub, if any of you have heard Liz speak, she is a disabled individual who spent 9 years in a facility, and she's 30 years old now. At the age of 30-something, she said to her mom and dad, I don't want to be here, I want to be out, I want to be a librarian, I want to get married. Well, Liz came out, and she's living in the community now, and she's a great advocate and a great speaker. She's married and doing her own thing, living her life. And basically, she said that what she taught us at the seminars, that people need to believe in people with disabilities. And you know, it's so easy to say that because how often do all of us put judgments on whether or not someone can come out and be safe and this and that. So let me see. People have the right to choose where they want to live, and it's really important for us as a group, including nursing facilities, including the community. We need to teach individuals how to advocate for themselves. People have the right to self-determine. You know, we also have the Freedom Center, the Centers for Independent Living, the Freedom Center and independent resource folks that I know come into many of your facilities. These folks also do transitioning. So it's important for people to have the opportunity to speak to individuals that come in to determine whether or not they would be interested in coming out to the community. The other thing that Liz spoke about, which I really, this is me, not sharing your opinion with people before they tell you what they want to do. How many times, let me tell you, I do it with my kids, I do it with my husband, I've got a big mouth. I always want to put my spin on life in general. And folks, it's not something, it's really a lesson that I'm learning, is that we need to ask people, what do you want to do? What are your plans? And not put our spin on it. We don't always have to agree with one's wishes, but really as a group, what we should be doing is helping people find solutions to achieve their dreams. Liz also spoke about be willing to stand back. How many times do you want to when you see someone tumbling and you know they're headed in a bad direction? We do it with our own children. Although mine are old and I still do it now, I do it with my grandchildren. But you want to save people. And it's how many times have we learned by allowing people to fall, but being there for them to help them get up again and start over again if that's what they choose to do. The other thing she talked about was encouraging people to take risks. I know all of you, and many of you have probably heard myself and Eddie talk about the dignity of risk. It's it's becoming a cliche, and people roll their eyes and, oh yeah, who are you to say? But let me tell you, people have the right to fail. People have the right also to fly. How are we going to know unless we open the doors and say to them, you can choose and you can make the decisions? Let me see.
Can I interject on that one?
Sure.
Just a real quick, when I first started to work for Division of Medicaid Medical Assistance as the project director, our first discharge, I didn't sleep for 3 nights. Just real quick, she was quadriplegic, she was visually impaired, and she was insulin dependent. I was so afraid. There were so many people at that table, and I kept saying, are you sure?
And she was
I'm really
blind.
afraid. Yeah, she was visually impaired.
Yeah.
She went through the program in a year. She's still out. She's doing wonderful. And I can just say, there were 3 nights I didn't sleep, but I learned so much about that, what Andy's talking about choice and allowing them to fly.
But also about encouraging people to take risks. Realize that we have adult protective services. There are probably some of you folks in the audience here. We have the ombudsman. Is Gail there's Gail. Gail Weinberg is our community ombudsman. I think, is Bonnie here today? I heard Bonnie was coming too today. Bonnie's one of the facility ombudsmen. So if we come into a facility because John Doe is looking at being transitioned out, we all have choices to say yes, no, whatever. Oh, ladies, hi, I didn't realize there's 2 more ombudsmen in the back. But, we also have the opportunity to bring folks in, to bring the ombudsman in, to bring legal aid in, to see, is this right? Now, and remembering, some of our folks have guardianship issues. And those aren't the folks I'm talking about here. I don't have control over that. Eddie doesn't. Unless the guardian agrees, that's a roadblock to us. But I will tell you this, we have had guardianships lifted. At least 3 that I can think of, which is a beautiful thing. Bill Washington, that's coming to speak to us today, was one who's had his guardianship lifted. Okay, so let me see here. Walking alongside people. Once again, we need to encourage people. You can do this. What can I do to help you? What plans, how do you think we can make this work? It takes a lot of time. None of this is a fast process, but it's almost like, extending your hand and it's here if you want it. A responsibility from all of us to do that and to take it easy, let people know that they're not alone and that we're willing to work with them. And the first thing is to me, the date of admission to Christiana Care or the date of admission to a nursing facility, we should be looking at that date as the point of getting people ready to transition out eventually, if they choose. And that's also a stumbling block, which as you heard Sharon talk about, everything that needs to be in place. People at the state facilities, what we're realizing, they don't have birth certificates, they don't have IDs. We're working with a woman that's been in the state facility for 40 years. Tell me what we can do, right? So it's a process of us working together and trying to make this work for people. And the other thing that Liz Weintraub spoke about is we have the right to change our mind. To me, I think we take for granted that folks in facilities, it's like, this is what you're going to do, this is when you're going to do it. You wanted this, now you got to do it. People have the right to say, I can't, I don't think I can do it. Can I do it at a later time? I think with Dawn, I see Dawn Edwards in the sitting down back there, and Dawn and I are working. We have an individual now who's a 23-year-old, young woman who has cerebral palsy. She's lived at home her whole life, and we actually didn't have a choice with her at the time we had no options left. She was sitting at Denver Behavioral Health. So she's in, but we're working on getting this 23-year-old out into hopefully either the Dartmouth Woods House or an adult foster care 2 program to see what we can do with the support of her mom. The other thing is I want you to remember Olmsted. It has taught us many things. What I want you all to remember is that people have the dignity of risk, and we need to look at the most inclusive environment and the least restrictive. And if we all keep that in mind, work as a team, we can make this work for those that want it to work for them.
With Money Follows the Person, I know we're out of time. With Money Follows the Person, I do have some flyers and some pens up here in the beginning. If you have any questions, please let me know. We also do discharges from Delaware to other states and other states into Delaware.